somewhere. And I don't know how to introduce Hal exactly because he's quickly become one of my favorite people. He's a dentist. He really was one of the key people, if not the key person, who started the whole ball rolling on this issue of amalgams in the mouth and outgassing of mercury causing a lot of health problems. So I think he's one of my own personal heroes, and so I want to give an especially warm welcome to Dr. Hal Huggins.
Thank you, sir. If you want a warm welcome, all you have to do is step outside. It's warm out there. Okay, I noticed it said something up there about informed consent. It's against the law. How many people here believe that? Am I the only one? I was supposed to tell you. Well, from personal experience, I can say it is. You don't want to do that. You know, we got kind of two branches here of people who work in the health profession. One of them called doctors, and the other called, are you a real doctor or just a dentist? Well, I'm one of the just a dentist. I think I still am. Have been for about 35 years here. And, you know, up until 1984, in the Code of Ethics, there was this little column that said, if you observe something that has to do with the health of the patient, either affirmative or negative, you are required to inform the public and the profession. You know what happens when you do that? Now, I discovered that mercury is a poison, and I figured I'd probably get a Nobel Prize for that discovery. And then I found out that Noah knew it. So there are several people ahead of me who have known that mercury was a poison. In fact, most kids who are in first grade know that mercury is a poison. The only people who don't know mercury is a poison seem to be the dentist. But then they've got a reason for that. Because if the dentist tells a patient that mercury might be harmful to them, there goes his license. You are not allowed to do that. And as a result of a few legal actions that have taken place in the last year, I don't know if you've heard this. I think it's a secret, but I've been told that I'm controversial. I don't understand this because all I say is, hey, mercury is a poison. Nickel can give you cancer. The stuff on root canals can be worse than that. Things that are substantiated by now 23 million bits of information. And so what happens when you let that information out? They change the code of ethics. So the code of ethics now says it is unethical to tell a patient that mercury is poisonous. It is unethical to tell them about cavitations. It's unethical to tell them about a lot of things. Why? I am in the middle of writing a book now called Uninformed Consent. Uninformed consent is probably what everybody in this room has undergone in a dental office. Certainly it's happened to me. You go into a dental office, you sit down, and what's the word? Open wide. And then you drill them, bill them, and fill them. Or drill them, fill them, drill them, some combination of those words. But what choice do you have? As a result of the legal things that I have been through, there is now a law in the state of Colorado that says, this is paragraph 182 of a 71-page decision handed down by the judge. It says, in the state of Colorado, a patient cannot ask for their amalgam to be removed for toxic reasons. Now let's imagine that you are a PhD in toxicology, and you know all of the things that mercury does to the human body, and you have studied this for 25 years, and you go to the dentist and you say, hey, what's this made out of? And the dentist says, that's a mercury filling. You say, I want it removed. Fine and imprisonment. You do not have the right to ask to have these fillings removed for health reasons. Why? Why is one of the first words in uninformed consent. And probably why is going to be one of the last words in informed consent. The why is something that you may have to figure out. Now, informed consent means telling you what's going to happen. Now, right now, informed consent on airplanes might be a little bit longer than it was a few weeks ago. Now, people getting a little bit nervous about these airplanes. I saw on television this morning, President, what's his name? Clinton. He was saying, now don't go jumping to conclusions that we don't know what happened to that airplane. And then it went to a fellow who was one of the investigators, and he said, do you know how big a 747 is? Do you know what it takes to make one of those things blow up that much? It takes a bomb. It takes a big bomb to do that. What do you mean, don't jump to conclusions? What other conclusion, Mr. President, can we come to? Well, informed consent, we all know there's a possibility we're going to get blown up, we're going to get hijacked, we're going to get this, that. And the other thing, what do? We fly anyway. Now, were you ever told that leukemia, multiple sclerosis, ALS, what's the one? Alzheimer's, thank you. That these things are also part of what you can catch in a dental office. Did they tell you that in a survey done in New York City of dental work versus how long was it before you came down with some incurable disease? Number one was multiple sclerosis within 90 days of the placement of a root canal. Were you told that there are certain things in dentistry that seem strongly to implicate that these particular materials may be one of the largest contributing factors to breast cancer in America today? And who cares about these things? Well, I've investigated the breast cancer thing a little bit, and I found well over half the population's interested in breasts. Some are male, some are female. It's kind of a mixed group here. But who's interested in finding out the cause of breast cancer? The patients that I saw were interested. The patients that I can no longer see are interested. Is this going to change? Actually, all of this started in this room 1 year ago because I said, we're doing some studies. We're doing some spinal taps on people, and it looks like we're going to find out something real interesting about what happens when you take amalgams out, what happens in the spinal fluid. And there were 3 men in dark suits. I don't see anybody in a dark suit. They're wearing t-shirts. That could be. Because they told the president of this astute organization, we're going to get Huggins for that. And they did. They did. And as Judge Nancy Connick said, the only way to stop Huggins is to take his license. I'm here. There are other ways to stop him. Like pane of glass here beside my desk. They didn't know the second pane was bulletproof. But still, missed my head by 4 feet, so, this is not much of a shot if you can't come any closer than that to a target this big. So am I concerned about it? Not a whole lot. Because I know what's going on. Pretty much it is known now that Huggins has been destroyed. So we'll just keep that in mind. But the one thing that I'm going to discuss with you today, and then I'm going to finish with one slide that is worth 20 years of my life. One slide is what we will finish with that shows why these fellows got so upset last year, because they were afraid I might come up with an answer. Guess what? Did I come up with an answer? I'll let you be the judge of that. How many rocket scientists do we have here today? 1, 2, 3, 4, 5. Yeah, this is a group where you can come up with more rocket scientists than you can in most groups. I think these folks are telling the truth. But we will ask our rocket scientists when we get through, and we will also ask those who are not rocket scientists what they think of this one slide. Can they figure it out? Because it's pretty scientific, I'll admit. But today what I'm going to tell you about is a series of the things why Huggins was brought to his knees. Informed consent. I was given a choice. I could either say that root canals and amalgam are perfectly safe and everybody should use them, and I could retain my license, or I could say no. The story is now history. You know where I stand. So what are all of the things that are done in dentistry? What is the informed consent that you do not deserve to see? This is the first time in my life I have used a video as far as a part of the presentation. But today we're going to do that because Pete happens to be right over here. Don't give him a hand now because you don't really know what he's done. But Pete put this video together for me. He's been with me for several months, 6 years now. And this is the quality of work that Pete comes up with that we show to our patients that we felt helped them to understand what was going to be done in their mouth. This is the informed consent that you shouldn't see. So may we roll it, please. We at Huggins Diagnostic have believed in the concept of informed consent for years. Since dental materials become a permanent part of your body that you cannot remove, we encourage patient participation in the selection of these materials. There are pluses and minuses for everything used in dentistry, but one thing is certain. Nothing is as good as your original equipment. No filling or replacement is as durable or compatible as your original teeth, bone, and gums. Here's a list of potential dental materials and procedures that can be placed by dentists. By now, it is assumed that you have read the booklets and other literature that have been provided to you, so that this information serves as a confirmation of the review of your education about dental materials. Amalgam is a so-called silver filling used by dentistry for over 170 years. Amalgam contains copper, tin, zinc, and silver powders mixed with about equal amounts of mercury, such that the mercury content is close to 50%. The American Dental Association states in its Guide to Dental Materials and Devices that mercury does give off small amounts of vapor under normal atmospheric conditions, but this evaporation stops as soon as the mercury becomes coated with saliva. In actuality, it has been proven that amalgam fillings constantly give off mercury vapor, and the amount increases dramatically during chewing. Individually, these 5 common dental metals are all monitored by the Food and Drug Administration, U.S. Environmental Protection Act, Occupational Safety and Health Administration, Clean Air Act, Clean Water Act, Hazardous Materials Transportation Act, the Agency for Toxic Substances and Disease Registry, and the Centers for Disease Control and Prevention. Every one of these agencies state that mercury, in fact all of these metals in the silver mercury fillings, are considered toxic. The American Dental Association admits that before being placed in the mouth, mercury is harmful, and that after removal during replacement procedures, it is considered a toxic waste. But according to the ADA News, when these materials are placed into your mouth, their toxic properties are rendered considered toxic. The American Dental Association admits that before being placed in the mouth, mercury is harmful, and that after removal during replacement procedures, it is considered a toxic waste. But according to the ADA News, when these materials are placed into your mouth, their toxic properties are rendered harmless. There is no data to substantiate this statement. Federal regulatory agencies monitor the public's exposure to these toxic materials everywhere in the environment, everywhere except in your mouth. In a study of reactions to patients' immune system, your body's defense system against toxins, the following reactions were observed. Copper adversely affected 95.2% of the population, tin 62.5%, zinc 94%, silver 66.8%, and mercury affected 90.2%. That's from a study of over 8,000 people, not just an educated guess, but a startling scientific fact. The mechanical properties of amalgam are generally superior to those of the plastics called composites, which are usually used as an alternative. The mechanical problems of amalgam are inferior to gold, however. The toxicity of the components of amalgam have been related to many autoimmune, neurological, cardiovascular, collagen, and allergy reactions. Removal of amalgam by the proper protocol has been shown to improve many chemistry imbalances and disease conditions. Composites are plastic materials suitable for use in filling decayed areas of the teeth. They are often used as an alternative to amalgam. Many composites contain materials that are offensive to some people's immune systems, such as aluminum, phenol, formaldehyde, and hexane. Serum compatibility testing is recommended for selection of those composites that will be least offensive to your particular immune system. Composites vary in durability and, sadly, the ones that last the longest usually contain the most offensive materials health-wise. For this reason, there is a great variability in the expected lifespan of composites, but it is apparent that the patient's lifespan must also be considered. The main battle between those of us who prefer non-toxic materials and the American Dental Association is the question, which is the most important consideration, the life of the filling or the life of the patient? Obviously, the legal implications of supporting known toxic materials for over a century play a big role in this battle. A cavitation is the proverbial hole in your head, a space in the jawbone that sometimes results from a tooth extraction. When a tooth is removed, there is a membrane surrounding the root that usually stays attached to the bone. This is called the periodontal ligament or periodontal membrane. It is a structure that shares fibers from the tooth with fibers from the bone that unite to form a hammock in which the tooth is suspended. Its purpose is to act as a shock absorber with a small amount of give to it so that tooth-to-tooth contact during chewing is not such a jolting experience. It also separates tooth from bone, making tooth removal possible. This hammock, or periodontal ligament, if left intact after a tooth is removed, communicates to the surrounding bone that the tooth is still there. This lack of communication of trauma prevents proper bone stimulation of the healing in the socket area. A dentist will rarely remove the ligament during tooth extraction because this is not commonly taught in dental schools. Were the periodontal ligament removed with the tooth, then exposed bone cells from one side of the remaining socket would grow to meet growing bone cells from the other side, and healing would be complete. If the periodontal ligament is left in place, a cap of bone only 1 to 3 millimeters thick will form over the top of the socket. This thin bony cap leaves a hole about the size of the root underneath the bone. Occasionally, this space fills with a gel-like substance, but for the most part, it is just a space full of air. The lining of this cavitation sometimes contains the chronic inflammatory cells contributing to autoimmune diseases. Indeed, occasionally dramatic health improvements have been noted immediately after cleaning out a cavitation. If the membrane, together with the unwelcome cells, is removed, then bone consents bone and proper healing can occur, thus eliminating a source of pathology to the body. Most wisdom tooth extraction sites, above 90%, form cavitations even present 20 or 30 years after the tooth was removed. Bicuspids removed for orthodontics leave cavitations less than 15% of the time. This is probably because there is a lot of bone remodeling during orthodontic movement of the teeth through the bone on either side of the extraction sites. Cavitations require special training to see on x-rays because, after all, you are looking at a piece of air within the bone. Although occurring less than 1 time in 100, a dental burr can enter the maxillary sinus when cleaning an upper molar extraction site, especially if the bone is thin and infected. Should this occur, normal postoperative procedures are followed. Do not blow your nose or sneeze during the next few days. Healing is usually not a problem. Occasionally, lower teeth cavitations will be close to the main nerve of the lower jaw, and getting close to that nerve with a dental burr can cause numbness of the area for several days up to several months. Again, this is a rare occurrence. I've never seen one, but it can happen. A non-precious crown is a term that is applied to a non-gold crown material. Today, about 85% of the crowns, sometimes called caps, placed by American dentists are non-precious. First, a word on crowns in general. When old crowns must be removed, or amalgam removal together with decay removal leaves too little tooth for a conventional filling, crowns of some sort will need to be placed, whereas fillings simply fill in gaps or holes in the teeth. A crown will replace the entire upper portion. Non-precious metals included in these crowns and bridges are nickel, chromium, cobalt, beryllium, aluminum, molybdenum, and tungsten. These metals are durable and inexpensive, but they have enough carcinogenicity and toxicity that they are also monitored by federal and state regulatory agencies everywhere except in your mouth. Most non-precious crowns are primarily composed of nickel. Nickel crowns are very hard, and the likelihood of a nickel crown breaking is quite remote. Nickel and its alloys, which are frequently referred to as stainless steel, are good for bridges due to their superior strength. The downside of nickel is that it is highly carcinogenic, or cancer-producing. For this reason, nickel implants in hips were given up years ago. In the form of braces, nickel has been observed to drop a student's grade point average by 1.5 points. In other words, from an A to a B minus. Emotional problems are more noted when nickel is present, but these problems are usually passed off under the excuse of being teenage behavior. Neurological diseases like seizures are found to be more prevalent in the presence of these metals. Gold crowns may look like gold and do indeed contain gold, but on close inspection, the amount contained is sometimes very little. As an immune reactor, gold causes problems less than 15% of the time, but gold is too soft to be used in its pure state. To be used in crowns, it is mixed with platinum and palladium to make it harder. That turns the alloy into a silvery-looking metal. The gold color is restored by the addition of copper. Copper causes problems in the immune system in 95% of our population. As many as 20 different metals may be added to gold crowns to improve their casting abilities and reduce the cost. Several of these metals can cause immune reactivity. Again, this is the reason we use compatibility testing in the selection of your crown materials. Crown and bridge materials that contain over 75% gold are usually found to be the best. But depending on what the other 25% is going to be, the compatibility test can best determine what's tolerable for your immune system. It usually requires 2 weeks in a dental laboratory for gold castings to be manufactured, and by then you will have returned home. For this reason, we at Huggins Diagnostic provide you with temporary composite or plastic crowns, depending on your compatibility. They are just what the term says, temporary. You will need to make contact with a dentist in your area within 45 days of returning home to make arrangements to replace the temporaries with permanent crowns. Have them follow your compatibility report in selecting an appropriate material for you. Most dead parts of the body, like the appendix, tonsils, gangrene, etc., are usually surgically removed from the body. Dead teeth, called root canal teeth, are great anchors for crowns, bridges, removable partial dentures, and even full dentures. A tooth has enamel as its outer covering over a layer of dentin. Within the dentin is housed the pulp chamber. Pulp chamber is a hole in the center of the tooth containing the nerve and blood supply for the tooth. When bacteria from decay reaches and kills the nerve, or an injury causes it to die, abscess and pain result. The dentist may then make a hole into the top of the tooth, enter the pulp chamber, clean it out, and place a wax called gutta percha into the chamber. Mechanically, root canal teeth have supplied firm foundations for dental procedures for over a century. Their toxicity is due to their ability through the generation of toxins within the tooth itself, not the filling material, that contribute to autoimmune diseases like multiple sclerosis, Lou Gehrig's disease, arthritis, lupus, and a whole gamut of other autoimmune diseases. Nearly 200 other diseases stimulated by root canals were described by Dr. Weston Price while head of research for the American Dental Association for 14 years. He amazed the medical profession with his ability to reverse many incurable diseases by the removal of root canal teeth. Again, due to potential litigation for having encouraged the use of root canals for many decades, the ADA hesitates to create a potential panic and open the floodgate of lawsuits by admitting that they have known of these problems since the 1920s. According to our way of thinking, you have the right to be informed of these things and to make up your own mind about the chances you want to take with your health before having a root canal procedure done just for convenience. Whether a sick tooth or a root canal tooth is removed or a cavitation is cleaned out, the procedure is the same. You will be supplied with what are called post-operative instructions. Basically, in addition to the detail about ice packs and so on, they will tell you to take it easy. Minimal exercise, lie down with 3 pillows under your head, do not swish water in your mouth, use the ice packs as directed, etc. Pain medication is supplied and take it before the pain becomes obvious. Far more medication is needed if it is taken after the pain becomes noticeable than if it is taken beforehand. Concerning tooth removal, bone has to fracture in order to let a tooth come out. Most of the time, these fracture lines heal without event. Occasionally, a piece of bone will be disoriented with respect to its shape, and the body will evict it rather than have a non-smooth surface. When this happens, sometimes up to a month or so after the surgery, this little fragment will come to the surface. It is usually sharp and irritating to an investigating tongue. This is not part of a tooth. It is a bone chip. Sometimes a fingernail can be used to flip it out, or if it is larger, a dentist may have to use a special instrument to slip it out. Once in a while, a blood clot will not adhere to the bone during healing. If the clot comes out, bone is exposed and pain will result. This is called a dry socket. Smoking tobacco within 24 hours after surgical procedures may cause the body to reject a clot, and a dry socket will result. Rinsing the mouth with even minimal force may also disrupt the clot and cause it to come out. Always wait at least 24 hours before rinsing with salt water, and then just turn your head from side to side. Do not use your cheeks to swish. After a tooth is removed, it needs to be replaced in most situations. Wisdom teeth are a notable exception. Missing teeth tend to allow the dental arches to slowly collapse and create chewing problems. How do you fill the spaces? What are the options? Front teeth in particular need to be replaced immediately after surgery is completed. This is usually done with a flipper. After wearing it for a few days, you will see why they are called flippers. Flippers help hold the clot secure as well as provide the aesthetics of a replacement tooth while healing takes place. An extraction site requires 3 to 6 months to heal to the point that a permanent or removable bridge can be placed. A permanent bridge is permanently cemented to the teeth on either side of the extraction site. Bridges require only slightly more care than normal teeth. There is a disadvantage to permanent bridges in the fact that the teeth on either side have to be cut down to accommodate the crowns in which to solder the bridged tooth. The alternative is a removable bridge, or as it is usually called, a partial denture. It should be made of a compatible material, of course. Most partials are made of the toxic nickel, so be aware of anything that has a silverish color. The advantage of a removable bridge is that adjacent teeth do not have to be cut down for crowns. The disadvantage is that they have to be removed and rinsed each time you eat, for food can catch under them. We are dedicated to removing immune-reactive and toxic materials from your mouth in as safe an environment as we can provide. We protect you with every available technique at our disposal. We will replace toxic fillings with those that are in the best interest of your immune system. Our further goal is to educate you so that you can make intelligent decisions about how to run your own life, make your own decisions, and take personal responsibility in maintaining an optimum lifestyle. Okay, can we have some lights up in the audience? Are you still there? Can we have the lights up here? Where is Pete? Is Pete still over there? You think he did a pretty good job on that? Okay, now you have been informed. That's the part that's not supposed to happen. So I suppose I've put all of you in jeopardy now. But this is what my life is all about, is telling you some of the things that are going on in dentistry. Now, how many minutes do I have? Left? Anybody know? What? Okay. I figure after that there might be a possibility that I stirred up a question or two. Okay.
I read that Sweden and Denmark have put ban
On the amalgam?
Amalgam.
Mm-hmm.
In this country, the dentistry is regulated by individual state agencies.
Mm-hmm.
Should we individually approach the individual state agencies and license dentists?
It could go either direction in the United States. It is true that Sweden and Denmark and Austria, Germany have all banned the use of amalgam. And in Switzerland, as of this last year, they do not teach the use of amalgam in dental schools anymore. It is of interest to me to note that at the dental school in Colorado, they don't teach the dentists there how to place the plastic fillings. In fact, about all they teach them is how to place the amalgams. From what I learned when I was in dental school, they are taught about 10% now of what I was taught in dental school. The main thing they do is teach them how to drill them, fill them, and bill them with amalgam, but not the plastics. Here we could go either direction. We could either have states outlaw the use of amalgam, or it could be done nationally. But the thing that is the closest to happening is informed consent. There are 12 states which now require, or that are now in litigation trying to establish informed consent, trying to establish the fact that you can see a film like this. The only state that's put it through is California. It is interesting that a friend of mine in California, we have a 6-page written abbreviation of the film that you saw. And this friend of mine's a dentist in California, and he says, you know, I like your informed consent. How would you feel if I use that in my office? And I said, sure, just erase my name, put your name up at the top, and you can use our informed consent. So he did, and a few months later, the State Board of Dental Examiners, with no previous warning, came storming into his office because he's a rabble-rouser trying to show this informed consent paper to his patients. And he said, but this is a law in the state of California. This is Senate Bill 934. It is a law brought up by Diane Watson that you must have informed consent in the state of California. And so I'm just conforming with the law. And they said, oh, we didn't know that. Now, in California, they tried in about 93 or 94 to put into effect a law that said, according to Proposition 65, which is a law in the state of California, all the dentists have to have this little sign in there, clearly displayed in their reception room, that says, warning, this office uses mercury, which is known to the people of the state of California to produce birth defects and reproductive harm. Of course, the dental manufacturers fought that. It went to appellate courts, and eventually they're not arguing the fact that mercury causes birth defects and reproductive harm. They're just saying that it would be too much of a problem to put this little piece of paper in with the amalgam when they sold the amalgam to the dentist. That didn't go over real well with the appellate court. They said, don't you put in about 20 or 30 other pages of stuff selling other products? Well, yes, and one more piece of paper is going to be burdensome. Anyway, it is based on something called preemption, which means to go before. The dental manufacturers are saying that since the FDA has classified mercury in Class 1, they have Class 1, 2, and 3. Class 3 are things that are really dangerous. Class 2 are just semi-dangerous. Class 1 is absolutely safe. There's no problem with it. Where do you think mercury is? Class 1, perfectly safe, nothing wrong with it. They say since the FDA has classified it as perfectly harmless, then the state of California has no right to have Proposition 65 saying you must inform people Prop 65 says you must inform people before you expose them to something that might do them harm. Doesn't say you can't do it. It just says you must inform before you perform. And this is what they're trying to fight with. The identical case, not with amalgam, but with something else involving FDA, just went through Supreme Court. And on the 26th of June, the Supreme Court said basically, no, FDA, just because it thinks something does not mean it's a law that preempts the state law. So now, within the next few weeks from California, we anticipate that dentists are going to have to put up this little sign that says, warning, these people are going to get you. And the American Dental Association, of course, does not want this to happen, because look what happened in Germany. The largest dental manufacturer in the world is in Germany, called Degussa. And I found out a few things. Degussa was interviewed on BBC, the British television, last year, and they said, well, it's true, we have decided to stop producing amalgam because there are some misdirected people out there who think that mercury might be a hazard, so we're just going to go into another field. Well, I found out just a couple of weeks ago there was something else behind this, and that was the out-of-court settlement of 1,500 cases. Now, I don't know how much money they shelled out, but it wasn't $1 a piece, I can assure you. But they settled 1,500 cases out of court and stopped making amalgam. What sort of a thing could we get into in the United States? According to the Public Health Service, they figured out how much it would cost to replace amalgams, because if FDA says, yes, dentistry is guilty of putting something in people's mouths that they knew was hazardous, there are about 3 things they can do. They can take the hazardous portion out. You can't take the mercury out of an amalgam. It's part of it. Or you can replace it, or you can refund it. Okay, what's the cost here? The Public Health Service estimate of cost is $264 billion. That's with a B. Now, if dentists have to shell out $264 billion, I'm in the crosshairs too, because some of the amalgams that I placed 28 years ago are still in the mouth. So I'm still responsible for those. I haven't placed them since 1973, but everything since then that anybody else has done would be a big legal problem. So this is the whole thing. It's not a matter of your health. Hey, you come down with leukemia, so what? Insurance will pay for a bone marrow transplant. You know, you come down with multiple sclerosis, we give you a free walker for a while. You come down with muscular dystrophy, we give you a wheelchair. You know, there are answers to these things. But people's health is not primary. Did I say I was shot at? Well, we can't be sure, because after all, it just broke out the glass. Maybe I've been around lawyers too much. Yeah, it is Huggins versus the state of Colorado. Just came out here a few months ago. It was a decision handed down by Nancy Connick, C-O-N-N-I-C-K, and the one that says you have no right to request amalgam be taken out is paragraph 182. That is getting to be very popular worldwide. I had a fellow call me tomorrow he really did call me tomorrow, because he's in New Zealand. It's already tomorrow there. And they were talking about it, discussing it down there. So it is known from yesterday to tomorrow. It's getting to be real popular. I think it's kind of humorous myself, but then I got a weird sense of humor. Yeah. We've got to talk about implants. I think my time's about up. implants are kind of a problem. Mechanically, it's great. You know, you got this space in here, no teeth, so you hammer something down in there and you can hang something on it, and boy, then you can eat apples, candy-covered apples and stuff like that, all the stuff, the candy and stuff that made you lose your teeth. You can go back and eat it again now. So there's a big advantage to that. And stability in the mouth. Yeah, I don't want something rattling around in my mouth. The only problem is any time you put a metal, a ceramic, or anything of that nature into the bone, you will create what's called an autoimmune disease or an autoimmune response. The body is going to start rejecting everything around it. The only difference is the speed at which that happens. Now, we had a case the other day where a gal had the compatibility report done and it says titanium is fine for you. So her dentist, for 12 grand, puts in 4 little posts of titanium. Bingo, her multiple sclerosis is back again. And she calls me and she says, you said titanium was okay. I said, it's okay in your mouth. And she says, well, I'm going to fly into Colorado. She's in Hawaii. And you're going to put that together for me. So I made her a removable partial after the titanium implants were removed. What do you think I made that partial out of? Titanium. Because titanium to sit in the mouth is okay. But in her, and in most people, it's about 98.5%, 99% safe. But anytime you put something into the bone, you will have an autoimmune reaction leading to an autoimmune disease, like whatever you're genetically susceptible to, diabetes, lupus, multiple sclerosis, any of these dental diseases. So from the mechanical standpoint, yes, they're fine. One of my closest friends is one of the best people in the world at putting in implants. And his best day, he put in 36 of them in one day. That's why I don't have any fingernails left. Things like this bother me. But people need to be informed. If you are in good health, you can probably handle an implant for 10 years. And who here wants to live more than 10 years anyway? That's getting to be too old. Yeah. I need to talk to my dad about that. He's, I don't know, something between 100 and 200 years old now. He's getting up there. So does that answer your question on implants? Did that give you the answer you wanted? I didn't think so. Yeah. What about dentures? Okay, let's talk about what about dentures a bit. Dentures, the plastic portion of it is what color? Pink. Okay. What color is the plastic as it comes right out of the package? It's clear. Okay. So we have to put something in it to make it pink. Here comes the trick question. What do you suppose they put in it to make it pink? Really good stuff. Yeah, you got a good start on it. Mercury. Oh. Mercuric sulfate and cadmium sulfate are both pink. So dentures contain either mercuric sulfate, cadmium sulfate, or both. Which one's toxic? Both. Now, let's go back to the clear acrylic. If you see through the acrylic, through the plastic, what do you see? The gum ridge. What color is it? Pink. All right. Now, especially in the lower denture, right down in here, yeah, it looks a little, you know, what's wrong with that guy's teeth? You know, it looks a little funny down there. So what we have done as a compromise is to put a little pink acrylic along here and along here, which is like 1/2 of 1% the amount of the pink stuff that you would have in the whole denture. Because who sees the palate? Nobody sees a palate unless they look in the glass at night or something. You don't see most of the denture. The only thing you're going to see is right here. So we would give our patients a choice. Do you want a little bit of pink here, or do you want it all clear? 9 out of 10 selected which? All clear. Patient's choice. If you want it up there, would I want it up there? Yeah. I would take a chance with that amount of mercury, but some people don't want to. But it's their choice. They're informed. They can make their choice. I can make my choice. Is that okay? Not in the U.S. of A. The dentist claimed he'd never heard of clear acrylic. That may be true. They've never heard mercury's poisonous either. Checked with the lab. The lab said clear acrylic doesn't exist. I can assure you it exists in Colorado Springs, and where we get it, you know, that stuff is kind of like, where do you buy a Chevrolet? Oh, you have to go to Detroit to get it. No, you don't. There are supply people all over the place. They are just feeding you a line, because I can assure you it is available in every place that dental supplies are available. Some
talked to my dentist when I took place, and I said to him, I said, what do you use to color this thing? He said, use the treatment of
Yeah, she asked her dentist what he uses to color the denture pink. And he says he doesn't use anything to do it. That's right, because it comes that way. It's the laboratory that did it. The dentist is okay. It's that mean old laboratory that put it in. If you had asked me 5 years ago what makes a denture pink, I would have said pink pigment. But I would not have known the pink pigment was mercuric sulfate. That's why I am informing, so that you can consent. Because dentists are not told. Now, this was hard for me to believe. Back in the 70s, I was teaching a seminar, and a dentist came up to me and he said, "You're not going to believe." Well, I tell you, I believe everything. He says, "You're not going to believe what I found the most interesting part of this 5-day seminar." Well, we covered an awful lot of material. What did you find the most interesting? He said that amalgam is 50% mercury. I said, "Your first name's Doctor. What's your last name over here? What are the initials?" It says DDS. I've heard a lot of things DDS stands for. But it really stands for dentist. I said, "You're a dentist?" He said, "Look, I went to school in the early 70s, and they had the amalgam in a capsule. You just grabbed a capsule, mixed it, put it in the tooth. You didn't know what was in it." He said they had mentioned in school there was just a small amount of mercury, more than a couple of 3 grams, in each one. But the dentist did not know, and your dentist did not know, had never been informed.
What about when you put that in plastic fillings?
What about the plastic fillings? Okay, on the film we talked about doing a blood test to determine what filling to put in, because there are anywhere from 8 to 12 different chemicals in each one of these plastic fillings called composite. What are the chances you're going to be reactive to one of those chemicals when they're like formaldehyde and phenol and hexane and styrene? I mean, do any of these things sound like something you'd find on top of a cake? This stuff doesn't sound real safe. But people do react to these things. And when they react, it's just as well you don't have it permanently implanted into your tooth. So a blood test can be used to determine what filling material you can get along and what you can't. And they're getting ready to cut me off here, and I want to show you my final. Who's in charge of the... There it is. All right, I told you that a year ago we had mentioned if we can have some of the heavy lights down so we can see this a little bit better. I told you last year at this conference that we were doing spinal taps on people, and we were finding this represents the fluid in a spinal tap. This has been put on a gel plate, an electrical current. Anybody here know anything about electricity? Electrical current comes off here, and down here you've got a little battery over here, actually it's a $4,000 battery power supply. And the heavy proteins start out here, and they don't get very far. And the light ones have more horsepower. They can go clear down here. But if you look, we've got a big band of proteins here, a big band of proteins here. There are 3 bands here you can't quite see. But how many tests were done here? Anybody want to give a guess? I mean, you're looking at the picture. 4? Some people say 2. There are 8. This is the before amalgam removal. Then 24 to 48 hours after the final amalgam removal, we did another spinal tap, and these are the toxic proteins that we find in the after. You see albumin here. Do you see anything here? No. Do you see anything here? No. Here is a before. These are all multiple sclerosis patients. And here is the before. You see there's similarity between these. This is a little bit darker. This guy was in a wheelchair. This is a little darker. This gal was in a wheelchair. But look what happened to the after. In every case, they were gone. Multiple sclerosis is not the only disease we did this to. But this is the reason they said, we're going to get Huggins for this. This is the this that they got Huggins for. Now, our 5 rocket scientists, would you say there's a significant difference between before and after? For our non-rocket scientists, is there a significant difference between before and after? Is there a suggestion that since what happened between here and here was the removal of the silver mercury amalgam fillings, do you think there's a suggestion, there's a relationship between mercury in the mouth and multiple sclerosis? What's your answer? Okay. That was a short hour. Thank you so much for your attention.
Thank you very much, Hal.